Good morning. On Monday, the FDA approved the Pfizer vaccine for 12 to 15-year-olds. The St. Louis County Department of Public Health, along with our EMS partners, stand ready to provide the vaccine, but we are waiting for the CDC to authorize its use. We hope that'll happen sometime today. That is something we expect the state to approve as well, and we may be able to start vaccinating as soon as Thursday. Once that approval is in place, we'll begin making appointments for this age group. As minors, they'll need a consent form signed by a parent or guardian. Copies of the form will be available at stlcorona.com. It's a form similar to the ones that's been used for 16 and 17-year-olds. A parent or guardian can bring their child in for a vaccination appointment, or they can sign the form at home and send it with their minor child to the appointment. We've worked closely with schools over the past year in offering guidance for in-classroom learning. We'll continue working with schools through the vaccination process as students prepare to get back into class. The Department of Public Health will offer whatever support it can to ensure the safety of our children and teens and the adults who work closely with students. Meanwhile, the vaccine for everyone 16 and older will continue to be widely available, and we strongly encourage everyone to get one. It's the best way to curb the virus and to create a safer community for all of us. We have vaccine events almost daily. Today we're offering 5 walk-up vaccination sites: the Bridgeton Recreation Center, the Richmond Heights Community Center, and at our 3 public health centers, North Central, John C. Murphy, and South County. Details on our vaccination events can be found at stlcorona.com. Last week, I toured Pfizer's St. Louis County campus and met some of the men and women who are developing the life-saving vaccine. A year ago, it was hard to imagine a vaccine could be developed, approved, and become widely available. But thanks to the talented teams at Pfizer, that's exactly where we are today. We leaned on the best and the brightest in St. Louis County, and the employees at Pfizer delivered. Pfizer is a primary vaccine used by the Department of Public Health, which now has administered more than 150,000 shots in total. For those who are interested in a J&J vaccine, you can schedule an appointment online at stlcorona.com. Those shots will be given Monday through Friday from 8 a.m. to 10 a.m. at the John C. Murphy Health Center. We are also continuing to offer J&J for homebound individuals and some pop-up and neighborhood events as well. We also are scheduling appointments for those who still need a second dose of Moderna. We're not regularly offering Moderna first doses, but we want to provide this opportunity to increase access to the vaccine and help ensure our residents are fully vaccinated. Those shots will be administered every Wednesday, including today, from 1 to 4:30 p.m. at the John C. Murphy Center. Those who would like to get the second Moderna dose from the Department of Public Health do need to bring their vaccine card with them and to make an appointment online. Because of wide access to vaccines, we've also been able to slowly relax restrictions. And because of vaccines and the continued support of our residents and businesses to follow our public health protocols, we are now seeing just under 100 new cases a day, based on a weekly average. It marks the first time since July 1st, more than 10 months ago, since our 7-day average has been that low. Let's hope this trend holds. This is a key metric showing our public health measures, along with increased vaccine availability, are making a difference. Finally, I'd like to thank the Missouri Legislature for passing a bill yesterday that creates a statewide prescription drug monitoring program. This has been a long time coming. As a county council member, I successfully led the efforts in April of 2017 to begin the county's prescription drug monitoring program. Missouri is the only state without a statewide PDMP program, and St. Louis County has been the de facto state program recognized by the federal government. I strongly encourage Governor Parson to sign this bill into law. Since our St. Louis County PDMP was put into place, 75 jurisdictions across Missouri have passed legislation to participate in and subscribe to the county's program. It covers 85% of Missouri's population and 94% of healthcare providers. A special thank you to State Senator Holly Reeder for working so hard on this legislation in Jefferson City. As a medical doctor, I understand how this program helps save lives. We are committed to addressing this public health emergency and will also have more to announce about opioid trends in St. Louis County in the coming days. Our Department of Public Health provides free Narcan at its clinics and is now providing a buy-mail option to ensure equitable access. The Health Department is also bringing Narcan to community outreach events. For more information about how to receive a Narcan kit, please call 314-615-8233. And I'd be glad to answer any questions.
Dr. Page, from West News Magazine, we have a question about the Attorney General lawsuit yesterday. It's in that lawsuit, it alleges that the county has not been transparent in providing the data for the public health orders. How do you respond to that allegation?
The question is about the recent lawsuit filed by the Attorney General regarding St. Louis County public health orders. We've been to state and federal courts 7 times over the past year with litigation against our public health orders, and St. Louis County has prevailed in every instance. I'm confident that there is a solid legal foundation for all of our decisions. All of our decisions are made based on public health experts' review of all the available data and research, which changes every day. Our decisions are made based on recommendations from the Pandemic Task Force and our health systems and from the CDC. That data is available to our website, and much of it was provided to the Attorney General in the very short time that we were given to respond to his inquiry. We'll certainly be continuing to make all of our decisions in the St. Louis County Department of Public Health based on science, research, and the CDC and public health expert recommendations.
Thank you. That's all we have today.
Thank you.